basics, which number one, seated in any kind of chair. Recliner typically works best, which we'll go over in a second. All you're gonna do though is kick that knee as straight as you can, hold it about 3 seconds, and relax. So what we're looking for here is a good amount of tension. You wanna feel this muscle get tight as you straighten it, holding it for 3 seconds, really feeling that squeeze, and then relax. Now, 2 points about this. Foot position really doesn't matter because you're still gonna be contracting this muscle. So you can have your foot relaxed, you can have your toes pointed up towards you. If you like that little stretch that you feel, totally fine, no issues there. Now, another point about this is that you can actually recline your torso back if that makes it more comfortable. A lot of times what happens is if you lean too far forward, your hip gets in the way, which isn't what we're working, right? We're trying to fix your knee. So recline back, might make it a little bit easier, but you're still gonna accomplish your goal of straightening that knee and creating tension in this quadricep muscle. Next exercise to work on your strengthening is mini squats. Now, I typically recommend people do this in front of a counter or a table, something they can hold on to just for their balance and a little bit of support if they need it. All you're gonna do, place your feet about shoulder width apart here, and you're going to pretend that you're sitting back. So I'm gonna push my hips back while also bending my knees. So knees bent here, hips also bent here. Now, I'm kind of leaned forward. That's totally fine. You don't have to have this position here where you're gonna fall back. What they don't want you to do is curl your spine like a turtle. Totally fine to hinge at your hips with a straight spine like so, and bend your knees here. Now, only go to the depth that you can tolerate, right? So if that's right here, come right back up, and so on like this. Now, and the other second point is try your best not to shift towards your non-surgical side. What that means is if you can see here, say I had surgery on my right knee and I'm going to go for their squat, a lot of times people lean over to the left. This is where the counter or table can help you out. If you need a little bit of support, it'll keep you straight down, pushing like so. Back and forth here, 2 sets of 10, 2 to 3 times a day. Now the last exercise for phase 3 when it comes to straightening your knee better is something called a terminal knee extension. Now it looks probably really similar to that quad set or the first knee straightening exercise I gave you at the first phase, but this time you're standing and we have resistance. So what I'm gonna do, I have this jerry-rigged up against my cable machine at the clinic, but what you can do is get one of these bands from your physical therapy clinic or a few of them, tie it around a table leg and then place it around your knee. But I'm gonna show you how to set this up. So I'm gonna put this just above my knee. So I'm just above the joint line here where I bend. I'm gonna step back so I have some tension. I'm gonna have my feet even with each other and I'm starting right here. This is my starting position because I'm gonna push back, put that heel down, straighten my knee as much as possible and hold for 5 seconds. I relax there and then repeat. Do about 10 of these for one set, 2 to 3 times a day. Right. Now, like I said, you get that band, but it may not be enough resistance. You can do this. This is typically a pretty strong movement, so you can load this up with a good amount of bands depending on your tolerance. Now these next 2 exercises are for if you're really stuck with your knee extension and you're really having a hard time getting it back. You can try incorporating these to see if they help you get that last little bit of extension back and help you get your function back to normal. First one here, sitting in a chair. What I'm gonna do is kick my surgical leg into a wall or a post or whatever feels comfortable for my foot. It's just gonna look like this. I'm gonna push and hold for 5 seconds and repeat that 10 times. Now, same as a lot of these other exercises, I'm looking for tension in this quad muscle because that tells me it's activating the muscle that is responsible for straightening my knee. The thing about this one though, is that you can change the angle that you're kicking. So say I'm right here now, if I scooch this chair back, now my knee is a little bit straighter, but I can still activate the same thing. What I want you to do is play around with this a little bit. So you could start really close to the wall, find what's weak. If anything's painful, you can back off of it and try a different angle. You don't need to have the pain. What I want is for you to build strength, that feeling of activating that muscle in your leg, and then progressively work towards getting straighter and straighter while still feeling that tension in the quad muscle right here, right? Again, 10 times, 5-second holds. That's a minimum work on it. If you feel like this one's good, if you feel some good tension there, then you can do more. It's not a problem. The second exercise to try if you're really struggling to get that knee extension back, which may help, is something like a single leg squat that's just modified. Now you can do this across your counter or across your couch, something that you can lay forward on and push your weight on, because what you're gonna be doing is having your surgical leg down on the ground, and I'm going to kind of lay my body across the table here to support my weight. I'm gonna lift up my non-surgical leg, and you see where my leg is here, it's still bent. I'm gonna push up, basically kind of like pushing my butt to the ceiling, try to straighten my knee like so, right? So it takes some weight away, but you're really working the strength of that straightening in your knee here, right? This one may be hard. Start with about 5 to 10 reps. If you're not able to hold the balance or weight on the leg by itself, this is not one that I want you to try. This is one if you're still stuck in your range of motion, but your strength is actually coming along. This may help you get that range of motion back. I hope that helps you get some of the straightening back in your knee after your knee replacement surgery. My name is Connor Ganzer. I'm a doctor of physical therapy. Go ahead and check out this video to find out if you're able to kneel after your knee replacement surgery and how to get back to doing so.